Thank you, Jill. Good morning and to each and every one of you, and welcome to our annual but first ever virtual roundtable event that again is brought to you by the Maine Council for Elder Abuse Prevention. Before I get started, Zoom's a funny thing. It allows us to look into other people's day-to-day lives, and for me, although I'm looking at the speaker view, behind me is actually paneling, and this is my office. So the state police has a rich tradition of history, and part of that is the paneling in our office. So just wanted to throw that out there as a little icebreaker. But much discussion had taken place among the Education and Awareness Committee that brought this event to you today. And each of us are sprinkled through this Zoom call. I don't think we'll identify one another as we go through, but we're going to really pay attention to see if we're able to meet that goal of bringing a meaningful education and future networking opportunity to each and every one of you by utilizing this platform. We went back and forth and we agreed that it was appropriate for us to bring this to you today. And we're going to spend the next couple of months looking at our notes that we're taking today, and we'll compare them to yours, and your answers will come at the end, but we'll be asking for you to complete a survey. But all of us on the panel agree that each of our disciplines in attendance today are providing critical roles to seniors and other vulnerable populations that we serve. Under normal circumstances, our work is challenging, but if you add a COVID multiplier, such as fear, no social visits, mask wearing, working from home, educating our kids from home, Zoom meetings, and we know the list goes on and on. The answer, and we understand, the result is increased challenges, not increased efficiencies in the jobs that we do. And we understand that's not only in our personal lives, but in our professional lives. So our goal here today is to offer support to everyone in attendance by actually highlighting 11 different disciplines across our fairly wide lane of elder abuse prevention. And we're going to hear them share stories of best practices, maybe some success stories, challenges certainly during COVID-19. But again, we want to energize all of you in attendance today to ensure that the collective safety net that we all provide remains strong for the people who need us the most during these unprecedented challenges. So at this point, it is my pleasure to introduce Dr. Shaw, who is the director of the Maine CDC, for some welcoming remarks.
Well, thank you so much, and good morning, everybody. I hope everyone is having a good morning thus far, and very much appreciate the opportunity and the request to join you all for a few minutes this morning. By way of introduction, my name is Nirav Shah. I'm the director of the Maine CDC, and I'm really honored to spend a couple of moments with everybody today for today's roundtable being convened by the Maine Council of Elder Abuse Prevention. Quick thanks to Jill Randall, who's the Medical Advocacy Director for Legal Services for the Elderly, who was kind enough to think to invite me today. What I'd like to do is spend a few minutes talking about where things stand at the intersection of concerns around elder abuse in these times of COVID. I think everyone who is joined today knows far better than I these staggering and sad statistics around elder abuse. Nationwide, worldwide, around 1 in 6 people who are over the age of 60 report experiencing some form of abuse in community settings just in the past year alone. Of particular concern is the fact that rates of elder abuse are high in institutions like nursing homes and long-term care facilities. In those institutions, 2 of 3 staff report that they have committed some form of elder abuse in the past year. These are reports by the staff members themselves. Now, again, everyone who has joined today knows quite well, and all too sadly, the serious physical injuries and the long-term psychological effects that can stem from elder abuse. Unfortunately, as not just our state, our country, but as the entire world ages, sadly, elder abuse is predicted to increase. And so all of these things in a normal year would be staggering and concerning from individual as well as a public health perspective. But layered on top of what we are already experiencing with COVID, the concerns in states like Maine are even more at the forefront than ever before. COVID has brought not just challenges to the healthcare system, but also challenges to keep and stay connected with older members of our communities. Now, as to the healthcare systems themselves, because of the intense focus around infection control and preventing the introduction of COVID-19 in places like long-term care facilities, the social connection that many staff may have with residents has been frayed somewhat, which can lead to even further isolation. All of those factors, sadly, can form the basis for later and longer term psychological impacts. COVID has already been a challenge from a physical health perspective, but again, when you add in concerns around isolation and loneliness and the inability in some cases to have a connection with caregivers, whether folks are in the home or in an institutional setting, the conditions are unfortunately deteriorating in that regard, and they make the possibility of elder abuse all too real and all the more likely. That's why I'm so glad that everyone has come together today at this roundtable to talk a little bit more and to speak frankly about the concerns that we're facing here. I know in chatting with folks and getting organized for today, the agenda today will allow everyone who's joined to hear from key entities across the state who are going to share what Mainers are doing to change the face of elder abuse. Individuals ranging from adult protective services and best practices around adult protective services, hearing from the folks at the Bangor Police, hearing from our state's long-term care ombudsman, all of whom are joined together to try to reduce the likelihood of elder abuse, particularly in this time of COVID. I'd like to end, though, on an optimistic note, at least as with COVID. Although COVID-19 has really presented significant challenges to our community, particularly older members of our community, as we go into next year, we anticipate that vaccines will be available, which will hopefully allow some more of the normal types of activities that can be protective against elder abuse, such as greater connection with family members, community members, to allow those activities to resume in some fashion. But unfortunately, before we get to that period of time, at some point next year when vaccines become more readily and steadily available, before we get to that time, things are sadly very concerning right now. Uh, for those who haven't checked out the latest COVID stats, things in Maine, across the country for that matter, have gotten significantly worse from a COVID perspective. Just in the past 2 weeks in Maine, we've logged more than 1,000 cases of COVID-19. And one of the measures that we use to track how the virus is doing in our state, the positivity rate, has more than doubled in that same 2-week period. And so while we are optimistic that a vaccine will eventually become available and will eventually get rolled out in order to allow folks to resume many of those connections that have been frayed, the pathway to getting to there from here will unfortunately involve significantly more cases. And although this is not directly related to elder abuse, it is directly related to COVID and COVID prevention. And that is this: one of the best things that we can all do to keep older, more vulnerable members of our society safe right now, to keep them from getting affected by COVID-19, to keep the institutions and homes where they live from being infected by the virus, the best thing that we can all do right now to keep those older members of our society safe is to take care of ourselves. What we've seen now in our past 7, 8, 9 months of experience with COVID-19 is that one of the strongest predictors of whether an institution, a long-term care facility, will experience high rates of COVID-19, one of the strongest predictors of that is what the rate of COVID-19 is in the community as a whole. And so, given how committed I know all of you are to reducing any harm to our elder members of Maine society, one of the best things that you can do to keep elder members of Maine safer from COVID is to take care of yourself, to reduce the likelihood that COVID is spreading in your community. Community rates of transmission ultimately become facility rates of transmission. And by doing things like wearing a mask, by engaging in social and physical distancing, by taking care of yourself, avoiding large gatherings, you can keep yourself safe from COVID, which reduces the likelihood that it will find its way into the homes of elder Mainers. This is really serious. The rates and the numbers of new cases are growing and growing every day. And I am deeply concerned that we will go back to a time period, as we were in March, April, and May, where a significant driver of the number of new cases and sadly deaths was coming from nursing facilities across Maine. But where we go from here is up to us. And so I'd like to leave everyone today with an ask that you take strong, concrete steps to reduce the likelihood of COVID-19 popping up and transmitting in your communities, because doing so will reduce the likelihood of having it find its way into nursing homes. So with that, thank you all for the invitation to join you for a couple of minutes this morning. I hope you have a wonderful day. I had a chance to look at the agenda. I'm sad that I'm not able to join you for more, but I'm really delighted that you're all coming together to discuss the important issues around elder abuse. So with that, have a great afternoon, everyone, and thank you for the invitation to join.
Dr. Shaw, thank you very much for your time. And you may sign off, but I'll just say this on behalf of all that brought us today. We know you're busy. We know your office is busy, but we truly appreciate what you're doing for all of us in Maine and the way in which you deliver your remarks. I think in a very unsettling time, the words that come from you certainly help calm all of us around. So again, thank you for your commitment to us and what you're doing for all of us throughout the state.
Thank you, sir. Thank you very much, everyone.
Okay, so we'll get started with our guest speakers. You've all seen or may have seen the agenda that was posted. Katie had posted that earlier on, but we're going to do our best to stick with the times and also the order in which our guests will join us. So up first, we've asked Brian Day from Adult Protective Services to say a few words of what things look like at his office and maybe be able to share some stories with us to help our daily interactions as it relates to elder abuse, financial exploitation. So Brian, when you're ready, please.
Thanks, Patrick, and thanks for the Maine Council for Elder Abuse Prevention for this event and everyone for joining us today. This is actually my first time attending this event, so I'm glad to be a part of it. My name is Brian Day, and I am a program administrator with the Office of Aging Disability Services, which is a part of Maine DHHS. Traditionally, the Associate Director of APS, Erin Salvo, would be doing this presentation, but she had prior commitments, so I'm happy to be here in her place. In my personal role as a program administrator, I oversee Adult Protective Services and Public Guardianship for District 8, which is more commonly known as Aroostook County. I'm happy to report we don't have any snow yet, but I know it's around the corner. But today, despite my position, I'll be talking about APS from more of a statewide perspective. I'm sure most of you are familiar with APS, but to quickly summarize our role in a nutshell, APS investigates allegations of abuse, neglect, and exploitation of adults who are incapacitated or dependent. So this includes allegations of self-neglect, which is when someone is no longer able to effectively care for themselves. When possible, we'll assist clients and their teams, and teams may consist of family, friends, providers, and others, with developing a plan to address whatever issues are presenting themselves. And how we respond really depends on the circumstances that are being presented. As with everyone else, and as Dr. Shaw had alluded to earlier, COVID-19 has certainly impacted the way that APS does its work. As the pandemic set in, APS staff quickly acclimated to our new remote work arrangements. And one of the first things that we noticed was a decrease in the number of APS referrals. Compared to 2019, the month of March had a 35% decrease in referrals. And again, compared to 2019, April had a 22% decrease, and May had a 29% decrease. So my understanding is that Maine was not unique in this decrease in referrals. Rather, this was a trend that was identified for the larger New England area. However, in response, APS collaborated with Legal Services for the Elderly and started running a public service announcement that some of you may have seen the commercial for on TV. We were able to fund this PSA using funds that were originally earmarked for in-person conferences that were no longer going to happen due to COVID. Starting in June, after that PSA was released, our referrals began to pick back up a little bit. There was a 16% increase for the month of June when compared to 2019. In the month of July, there was a 15% increase, and then a 12% increase for the month of August. And with the most recent data available, there was a 30% increase when comparing September 2020 to September 2019. So in other words, our referrals are getting a little bit back to normal. APS staff have been predominantly working remotely, and this current arrangement is expected to remain through at least January of next year. In order to account for the safety of our own staff, as well as others, we modified the way that we interacted with our clients. As is common knowledge now, those who are most vulnerable to COVID-19 are elderly and have prior existing health conditions, both of which are commonly true for the population that we work with. Accordingly, we tried to avoid unnecessary client contact while balancing APS's need to observe and ensure safety with the risk of potential exposure. And that was potential exposure not only for clients, but for our staff and for all the other people that we may come into contact with. So one of the first things that we did, which is quite common nowadays, is to conduct a set of COVID screening questions before establishing contact. And this would happen during the intake process when a call came in, and also prior to us going out and meeting with someone if that's what we had decided to do. Then we would attempt to determine if contact could be established using technology, predominantly through video calls. Now, as you know, there is a technological divide, not only in having access to the technology and being able to use technology, but also having reliable internet service. So if that was not an option, we would attempt to conduct a visit outside to the extent possible, wearing masks and maintaining social distancing. As we got more information about COVID and the best practices, we would update our guidelines to reestablish unannounced visits with the focus on certain factors, such as clients who are at immediate risk for physical or sexual abuse, clients who are injured and at risk for further injury, or clients who are without supervision and incapable to provide care, among other factors. Most recently, we've updated our guidelines specific to residential settings, such as nursing facilities, group homes, and independent living, among others, and gauge our response accordingly depending on the setting that they're living in. In order to keep everyone safe, we work with the county emergency management associations to acquire personal protective equipment, or PPE, so masks, face shields, gloves, gowns. We also partnered with the National Guard to be fit tested for N95 masks in those situations where one is necessary, and for those staff who are able to wear them. And so APS staff have been doing very well in adapting to these new practices. Certainly commend them for all their hard work. And I also commend all of you for partnering with us in keeping Mainer safe, especially during the pandemic. I don't see any questions yet, so I'll jump into some non-COVID news. So APS is in the third year of our Administration of Community Living Grant with the federal DHHS, where we're working with elder advocates from the Elder Abuse Institute of Maine. We have some counties that are partnering with elder advocates, particularly post-investigation, in order to follow up and provide assistance in some areas that are beyond the scope of APS. And one of the ones that I find to be most interesting is the restorative justice, which is especially poignant since most elder abuse is committed by a family member with whom a client may want to retain or reestablish a connection with or a relationship with. And so restorative justice can assist in that. Other counties are working with goal attainment scaling, and others are continuing their work as they were before the grant. And then the University of Toronto is assisting us in the research aspect. So we'll have some great research at the end to determine how effective each of those programs are once the study concludes. APS has also partnered with the National Council on Crime and Delinquency in providing a new evidence-based format to gathering information on APS referrals, and then also evidence-based safety assessment that investigators complete out in the field with clients when appropriate, typically during our initial contact. This is mostly work that APS has been doing for a long time, but the format standardizes it across the state and helps more clearly document the work that we're doing, especially during those initial contacts with clients where some type of intervention is often needed most. Finally, our internal training program continues to evolve to provide standardized training for all APS investigators, which is helpful for everyone, myself included, and especially helpful for new APS investigators. Some of these trainings are provided using internal staff, such as our training program manager, David White. Oftentimes, David will partner with other entities in securing information relevant to APS, a recent example of which is a sexual assault training, which we're partnering with the Maine Coalition Against Sexual Assault and presenting to our staff. That pretty much wraps up my presentation. So again, thank you all for working with us and partnering with us and helping keep Maynard safe. And as always, if you suspect abuse, neglect, or exploitation of a dependent or incapacitated adult, please give us a call at 1-800-624-8404, and we'll see what we can do to help out.
Thank you, Brian. If I could just, I'll use you as an example, but would you mind putting your contact information and phone number in the chat? I suspect that as we continue today, there'll be some questions that someone may want to reach out directly to you if we don't have time to answer those within the chat. So as we go, I'll probably make that reminder with each person. But if you have a question for Brian, or you're stumped on something, or you just have want to work through a particular set of circumstances, he will provide his name and contact. I know it's listed, appears to be on the agenda, but it will also be here as well. So again, Brian, I appreciate you stepping up and filling that role. We miss seeing Aaron, but understand that it's a busy time. So thank you very much for that.
Thank you.
Our next speaker, we wanted to capture the law enforcement pulse, if you will, across the state. And Bangor Police Department has a unique role. They have community police officers. And my friend, Officer Elizabeth Ash, fills that role for Bangor. She is on the streets often working with folks that we may not see every day. And we asked her to chime in with us, maybe offer a little bit from the law enforcement perspective to see what that looks like during all these COVID-19. So Liz, welcome, and I'm gonna mute my mic and turn it over to you.
All right, well, thank you for that intro, LT Hood. Keep me honest about my time here. Don't wanna run over. So I am Officer Ash. I am the Community Resource Officer for Bangor PD. It's a unique role. They pulled me from patrol to fill this billet for 3 years. And basically my role is to plug myself into the Bangor community, be a part of neighborhood watch groups, be a part of various shelters, be a part of various neighborhood initiatives, essentially, and try to keep a pulse on the community and just be a friendly point of contact for people throughout the Bangor community. So that's a little bit about who I am, and I have the pleasure of attending this conference now for 2 years, and I learn a lot every year, so I'm really excited to be able to speak this year. So again, I was asked to speak about what we are seeing in law enforcement for the state. That's a large task, but I could speak specifically to our neighboring towns and to myself specifically, because when elder abuse does appear, it will generally work its way up to our detectives floor, or they'll send it over to my desk because I have more time to actually, unlike our patrol guys who are running from call to call to call, I have more time to actually dig a little bit deeper and do some more investigative work into it. I haven't seen any crazy spikes in elder abuse cases that are coming across my desk. But I wanted to begin my talk at least with a legal update that was brought to my attention. Attorneys on the call, please excuse me if I butcher this. I'm going to let you specialize in what you do best. But for my purposes, I like these legal updates because it increases my own personal toolbox and also makes me aware of things that I should be looking out for. And also folks who aren't in law enforcement or are not attorneys, just makes them more aware of what could potentially be a crime. So I'm looking at Maine Law 17A, Chapter 23. It falls under offenses against the family. I'm sure many of you, especially our legal scholars on the call, know what I'm sort of going with here. It's subsection 555, and it's called endangering the welfare of a dependent person. I believe public law, which was made in 2019, recently was added to. Looking at subsection C and D, I won't read the whole thing to you. I don't want to put anyone to sleep at 9 o'clock in the morning. But some things to be aware of. It states that persons recklessly infringing on a dependent person's right of association, including but not limited to the right to receive visitors, mail, telephone, electronic communications, i.e. email, for the purpose of establishing or maintaining undue influence on that person. That's a Class D, so a misdemeanor. And then if they're doing it intentionally and knowingly, that could be a felony. The reason I'm bringing this up at the start of my talk, not really COVID related, but it is new law, is that keep this in the back of your mind if you're seeing someone being denied rights of association, meaning they're not being allowed to have visitors, they're not being able to establish their own email accounts and check their own mail, et cetera, et cetera. Always, like we learned in previous sessions here, APS reports can't hurt. Absolutely give them a call. But if you have a friendly community relations officer, such as myself, feel free to reach out and say, hey, look, I remember that statute. I looked it up. I'm not a legal scholar. Neither am I. But something doesn't seem right here. Maybe there's some criminal activity going on. So again, just feel free to reach out. Remember the statute. I can include that later when I give you my contact information. It's just another good tool to have in the toolbox. With that, I'd like to move on to more COVID-specific impacts on law enforcement. Sort of like, sorry, the firefighters are going there. I don't know if you can hear them. All right, I think they should pass soon. Sort of like what Dr. Shaw was alluding to, isolation. I think my brief could basically be summed up into the dangers of isolation and 3 subcategories or 3 sub-takeaways from that, which would be understanding new threats that come with isolation, digging deeper into opportunities for all of us to possibly see elder abuse, which is, as we know, historically very hard to do, and then asking for community help and reestablishing ties from a law enforcement perspective. So let's tackle that first subsection, which is understanding new threats. I recently had the pleasure of speaking with a director of communications for AARP. She has plugged me into the world of scams targeting elderly individuals. And right now, at a nationwide level, we're seeing an increase in cyber malactors. But more specifically, there has been an increase in phone calls targeting vulnerable elderly who are locked away in their homes right now. And they're preying on their COVID fears. And what I've been told is that they are being requesting to buy products related to COVID, face masks, et cetera, or even cures for COVID. So again, why they are at home, there's a new threat, and it's coming via email, it's coming via phone call. And actually, I was speaking with one of our patrol officers last night. She reached out to me because she just took a report of an elderly individual who received a phone call that their blood was found on a car somewhere in Texas and that they needed to go and buy gift cards immediately or else a warrant would be put out for their arrest. And because this elderly individual was isolated at home, she didn't have the support network that she normally would have. And she ran out to Walmart and bought 2 $500 gift cards, her money for the entire month, and provided the scammer with the gift card information. Thankfully, the Walmart associate didn't activate the cards appropriately, so the cards were never activated. And the only reason she knew it was a scam, she was told not to report it, like there's going to be a warrant out, you're going to be charged with murder. So she was terrified. Was because she finally told her daughter what was going on, and her daughter then brought her to us for assistance. So again, we're seeing a new type of cyber and more electronic threat coming into the home as people are isolating, but also a new type of personal threat. I reached out to a friend at a local charity, and she specializes in lower income homeless elderly individuals. And she said she's seeing housed elders who sometimes associate with transient individuals in our community, people experiencing homelessness, and they're being taken advantage of. She said that's a new trend that she's tracking, and she'll keep me on the loop, where they might be all hanging out, and then all of a sudden, a transient individual moves in with an elderly person, say they're living on a voucher. Then all of a sudden, their friends all move in. Then all of a sudden, the elderly person who held the actual apartment is now sleeping on a couch outside in the yard of their own apartment. So again, just checking in with our community connections. She was helping me track on that type of new individualized threat that we're seeing. That's all COVID driven because again, it's really hard to find apartments right now. And again, that's a specialized community that she sort of opened my eyes to. Subsection 2 of the dangers of isolation would be digging deeper into opportunities for investigation. I remember speaking with a banking connection who I actually met here through last year's forum. And she told me a story about they had to redo their practices with drive-through banking. Again, bankers in the room, if I am messing this up, let me know. but basically all banking was done via drive-through. And it really stuck with me because she said normally they have time to schmooze and have coffee and interact with people, but now it's you drive through and that's it. Here's the money, and you can't necessarily see any odd bruising. You can't see any interpersonal relations going on. So she and I were speaking about other practices that maybe have changed and how their call volume is going up and they're doing more things virtually. And we started discussing, hey, with changing procedures, have you guys ever considered, I'll ask anyone any question, I'm shameless, but have you ever considered maybe institutionalizing something where if there's a level of comfort, especially more in the rural parts of the state, adding questions like, hey, like, when was the last time you ate, to see if there's food insecurity, or hey, like, have any good meals recently, and just dig a little bit beyond, say, necessarily traditional banking, because we really want to seize opportunities to engage individuals. And that's true for law enforcement as well, just reminding our patrol guys, like, look, if you have the opportunity to engage safely, COVID rules being respected, with an elderly individual, open up your scope of, or open up your perspective and look in the house. Are there empty cupboards? Why is the homeowner or the apartment owner who is elderly sleeping on the couch and there are 3 other bedrooms that are occupied? And really seize those opportunities to dig a little bit deeper when we have them in a safe environment. And then finally, just reaching out to the community for help, because people are in their homes, they are more isolated. And we need to reestablish ties with our community partners, people who will call me and say, hey, Liz, I don't know if this is a crime. I already called APS, but could you do a welfare check, or is this even worthy of a welfare check? Because speaking with some of our community partners, they call APS. They have that down. They know they're mandatory reporters, but just reminding them, hey, I'm here too. Or even your local deputy is there as well. I know in smaller towns, they have even closer relationships with their PDs. Just feel free to reach out to us too and say, hey, look, is this worth a welfare check? Like someone mentioned something about 17A, section 555, I fell asleep. Is this something that would fit that? Just remember us, and I need to also go out there and reestablish ties with community members as well, that we are a resource. If you think something is missed, just keep reporting it to us and APS as well. That's all I got, unless there are any questions.
I just unmuted myself. So Liz, thank you for stepping up and doing that for us. On that welfare check, as you know, that's a big part of our job sometimes, where something doesn't fit in the criminal lane. And there's nothing wrong with going to the door, or maybe it's a window, or through a deck, and having some type of positive connection with whoever's inside. We all understand that we need to do things differently. And I think most in law enforcement have really accepted that. And we're pretty good at being different. But if it is that welfare check or some other means to check in on somebody you haven't heard from for a while, that's what we can fill. And again, even though it's not criminal, it's an opportunity for us to make a connection and again, make that warm handoff if that's what it turns out to be. But we're happy to do that role. And she said, it may not be the Bangor Police. It may not be the Maine State Police. It may be a local police department where your loved one lives. It may be a sheriff's department. But in the end of the day, we all are doing this for the right reason and to make sure that person is in fact safe. So Liz, if just, I think you're going to drop your information into the chat when you get a chance, and any offline conversations certainly can have with her. So once again, thank you. And we will introduce our next guest speaker. It's Patty Kimball from the Elder Abuse Institute of Maine. So Patty, I'm going to do my thing and allow you to do yours.
Thank you very much. It is a pleasure to be here with everyone today. As most of you do, I so wish this was an in-person event, and have gotten very used to these types of conversations. So despite the fact that we can't be together, it's wonderful to see all of your faces and to hear from our colleagues who are working across the state in a very difficult time. So my plan today is to tell you a little bit about what we're doing at the Elder Abuse Institute of Maine at this time, and how any of that has been adjusted to COVID and as noted, the challenges that we're facing as well, our clients are facing. So we at the Elder Abuse Institute of Maine, we do our work in basically 3 buckets. We provide direct services to older individuals in the state of Maine. Both those are those who are at risk for abuse and those who are victims of abuse. We also do training, education, and outreach. And the third bucket of our programs looks at research and advocacy. So many of you know, hopefully, of our program, Martha's Cottage, which is a transitional housing program for older folks who are in unsafe situations, experiencing abuse, and need safe, confidential, transitional housing to help them move out of those situations. Our primary site for that is in the Portland area, and we're fortunate to be opening 2 more sites despite COVID. Up in the Aroostook County area and in the southern Mid-Coast area. It's an interesting time to be trying to open housing. While housing is very much needed, it's also a challenge to provide housing, especially if there's more than one person living in housing during COVID times. So what we've done to sort of address that is help people when they call us, help them try to find other options if our housing isn't appropriate. Our housing is transitional, it's not shelter housing, and also folks have to be able to live independently because we don't have capacity for on-site support 24/7. So our housing isn't always appropriate for people that need it, but we have the ability to help people find housing where it is needed. So definitely Martha's Cottage program has had to adjust to COVID. Our hope is that as things, as we get through whatever time period we're getting through, that we can, that those services will become more available. The other program Brian mentioned, Brian, thank you so much for talking about the ACL research project that we are super excited and fortunate to work in partnership with APS around. So as Brian said, we have elder advocates that work up in Aroostook County and then down in Cumberland County. It's an amazing project, amazing. And I want to do a shout out to our advocate staff who work incredibly hard with the clients that Brian's folks refer to us. All of our referrals come from APS. In the last year, we launched that program in July of 2019 and have worked with 140 plus people to date through that program, all of whom have been referred to us through Brian's folks at APS. And these are people, as you can imagine, who are I hear a common thread today, which isn't unusual, who are socially disconnected. So they're already disconnected. They're people whose relationships are fractured, who tend to be extremely isolated with very few social supports. So as you can imagine, as all of our, as we've all experienced, our concern around that social isolation has really increased dramatically because of COVID. And we know that people are at more risk. We know that people don't have the connections in normal life that they do, let alone during COVID. Some of the things we are doing to address that, we did start a letter writing campaign early in COVID to try to connect our client, to ensure that our clients got some connection to somebody in the early days, especially as it was pretty scary. That was an exciting project. We were able to work through our advocates, we were able to work with some UNE students to send letters to our clients. And it was our hope that our clients would actually send letters back so that there would be some reciprocity and that people would feel like they had something to contribute, not just receive. The other thing that became apparent to us, a lot of our clients, again, before COVID had difficulty, didn't always have access, don't have access to sometimes cell phones, sometimes their minutes run out, definitely not technology. And so this became a real concern for us during COVID. And we turned our attention very early on to figuring out how to access technology for our clients. And we're thrilled to receive some funding through the Maine Community Foundation. If anybody's on the phone from MCF, thank you very much. And are partnering with the National Digital Equity Center out of Machias to link our staff with our staff and our clients with iPads so that they can take advantage of remote access and telehealth appointments if that's important, and also so that we, because we are also doing our work remotely, are able to better connect with our clients through technology. So we're thrilled about that. We definitely think that that is an opportunity that COVID has presented for us, to connect people who have been otherwise digitally disconnected, and introduce them to the benefits that we all gain from access to technology, and hope that that will help strengthen connections. The other project we're working on that is, and before I leave that, I wanted to just note what Brian said about restorative justice. We have four, through our ACL project with APS, we have four sort of modalities that we work in. One is motivational interviewing, one is teaming, one is supported decision making, and another is restorative justice. And what that allows us to do is work with clients who are victims of abuse, neglect, or exploitation, and also any family members that they want us to work with. So as Brian said, and we all know this, that oftentimes abuse is perpetrated by a trusted caregiver. The last thing our clients want in a lot of situations is to sever that tie. What they want is the abuse to stop, and they want the relationship to be repaired. So when it's safe, when it's appropriate, we are able to look at things through a restorative lens, which I think is transformational in how we do our work. So, so that is a really exciting component of the project. The other program I wanted to talk briefly about is some work we're doing through the Robert Wood Johnson Foundation. We were fortunate to receive a research fellowship last year. We have some partners at USC and at NYU who are working on the reporting of elder abuse, specifically with home health care workers. So one of the things we know, again, don't have to tell all of you, is that home health care workers see, they're in homes, they have trusted relationships with older folks, they see so much of what's happening in the homes. And so what we want to do is support them in their ability to manage, understand what's happening, and to report it. So we're going to be launching a warm line for home health care workers, specifically to help them if they have questions about some clients that they're seeing. Is what they're seeing abuse? Should it be reported? For some folks, we know reporting to APS is scary. And so if it is helpful for us to help walk them through how you would report, and even give them some tips and tools for working with folks who they have concerns about. So that warm line is a really exciting, hopefully an exciting addition to our state's sort of menu of options for folks. We're launching it specifically with home health care workers. It will be available for anyone, and we're hoping to, if it's successful after we research it, to expand it. So that's a pretty exciting project, and hopefully a new offering in the state. Finally, I just want to talk about elder outreach and education. If any of you know Chris Wolf, she travels by boat and actually also by plane across the state of Maine to do training in the far reaches and our urban centers. Clearly with COVID, that has not been able to happen. And so her work has turned remote, and we're excited that we're in the process of developing a remote training that we can take to different places via this lovely tool we have called Zoom. We're hoping that it's interactive, multidisciplinary, and a useful tool for individual groups, for large organizations, for communities across the state. So that is in development, and we encourage any of you to call us if you would like training for your staff or a community group. Please feel free to give us a call. Age-friendly groups, we welcome you to give us a call. Chris is one of the most flexible, amenable people I know, and we'll go where it is needed, even if it's remotely, to help people understand the signs and symptoms of abuse and bring us all to that call to action. So thank you very much for your time today, and it's a delight to see you all and be part of this work in partnership with you all.
Patty, thank you very much. Very powerful. It's funny you say that. We even just being in the presence of all of us who normally would be in a room, this is still pretty energizing to see everyone's face. We're all still doing our day jobs, and it's just good to see all the good information coming across. So again, thank you. And Patty, if you just update your information when you get a chance into the chat, if somebody wants to talk offline, a specific question to you, I'd appreciate that.
Patrick, I wanted to note that I also have some paneling behind me. So I really appreciated you highlighting your paneling, and I wanted to share mine as well.
Yours looks like V-match. It's a little different than mine, but okay. It's our home office, right?
There you go. It is what it is.
So our next
Ooh,
speaker, we're going to invite Trinity Baker from the Long-Term Care Ombudsman to say a few words about what things look like in their world during COVID-19. So Trinity, go right ahead.
Thank you so much for that introduction. And thank you to the Maine Council for Elder Abuse Prevention for putting this on. I really enjoy the roundtable every year. I think this is my 3rd year attending, and I always get a lot of information from it, and I really enjoy working with all of you. So the Maine Long-Term Care Ombudsman Program is a nonprofit agency, and our mission is to advocate for the quality of life for residents in long-term care settings, and that would include residential care, assisted living, as well as the nursing homes. Our services are free and confidential. Federal and Maine law authorizes all of our staff to investigate complaints made by or on behalf of long-term care consumers and to assist them in exercising their right. That is guaranteed by law. So our organizations, our advocacy services, we maintain strict confidence. So anyone that is reporting to us can be assured that we are going to keep all information disclosed unless we have written consent from the resident of that facility. And our advocacy work provides and focuses on supporting the wishes of the consumer. So we're always working towards the consumer's goals and wishes. So up until the latest CMS guidance released in September, we've been restricted from entering facilities. So we've had to pivot quite a bit. I would say like 95% of our work is in facilities and actually physically in them. So we've had to pivot a lot to ensure that we continue to serve as many long-term care consumers as possible in all of the long-term care settings. So initially, regional ombudsman staff reached out to residents that we had worked with in previous years to check in, see how they're doing, make sure they know that we're still here to advocate for them and their needs, ask them if they had any concerns or complaints or needed any resources through these uncertain times. And then we focused on attending resident council meetings, which looked much, much different than normal. But we were our goal was to attend and get in front of residents and with residents in any way we could. So whether that be a resident council meeting of only 5 residents or the one-on-one contact with the residents with the help of the facility, we were kind of focused on doing anything we could to get the word out that we're still here and advocating for them. And then we attended family councils, and we also developed family councils, which actually was amazing. And I think we had a lot more, a better outcome because of the Zoom ability. Families didn't have to go somewhere, leave their work, leave their families. They were able to attend right on Zoom. And then sending brochures out to facilities so they can provide our brochure to residents. We continue to connect with all Maine nursing homes, assisted housing programs, residential care, and assisted living facilities, at least quarterly, exactly how we did before. We continue to follow up on core survey results and working with facilities on their plans of correction. We're also working with families and residents with their concerns about the current restrictions. That has kept us very, very busy. We've been working directly with facilities on implementing compassionate care visits, reintroducing socially distanced activities and communal dining. Of course, following the CMS guidance, which seems to change very frequently. And we're kind of really helping facilities navigate through that guidance and supporting families as the facilities are trying to figure out that guidance. Providing families and resident support through these uncertain times. Regional ombudsman staff continue to attend elder abuse task force meetings and collaborate with other local organizations that we have always worked with, but it seems like we're working more closely with those other organizations through this difficult time. We plan to start working on updating the mandatory reporting project that we worked on in 2015. It was called the Speak Up campaign, and it provided resources for direct care staff and all of the long-term care settings and home care settings. So we're really excited to start working on that project again and updating that for all of the staff. Our executive director is an active partner in the Elder Justice Coordinating Partnership. So our services continue to be offered for all residents of nursing homes, assisted livings, and residential care settings, as well as home care settings. So if anyone has any questions, you're welcome to call our program, and I'll put my information in the chat box as well as our intake workers information. We really are here if you need any resources and any assistance with residents in long-term care settings.
Trinity, thank you for the update from your shop. But if I could just ask you, we had loved ones some time ago that had spent a lot of time in a nursing home, but are you able to tell us at all about, we understand that families, a big part of that is visitation, families coming in, but does the staff fill that role? I know they have a role to fill, but as far as making the member feel connected as best they can, is there any technology that is either allowed in, or families bringing in iPads, that kind of thing, and it's up to the staff to ramp up that level of comfort with the devices?
Yeah, that's a really good question. So at the beginning of the pandemic, facilities were responsible for gathering those devices for the virtual visits with their families. I know that a lot of facilities received grants or donated iPads or tablets, whatever devices they wanted to use. But the latest CMS guidance also provides funding for facilities for those as well. So at the beginning, just like the work that we do, it was completely virtual. And we were assisting facilities in making sure that they have a schedule for the residents, that families are able to call and get on the list to have virtual visits. I know that personally, as an ombudsman, I worked with some families where they were having difficulty because the resident wasn't participating and understanding the video chats. So, we're working with them just to figure out however we can get support to the resident. We'll figure out a way to make it happen. And then, then additional guidance came out from CMS allowing window visits, which sounds wonderful and sounds simple, right? But you actually have to have a schedule. The window visits have to be supervised. We had issues with families opening the windows. So it sounds very simple, but it really wasn't that simple. And then CMS also released additional guidance in September for more ways to reintroduce indoor visits and compassionate care visits. So it's ever changing, and you have to, what we stress to facilities, you have to be person-centered. A video chat is not going to work for every resident, and a window visit isn't going to work for every resident. And families, they all have different schedules. So we just kind of focus on being person-centered and what will work for that resident and their family.
A window visit. It's not a whole lot different than we would do if we're going to check on somebody, but I would have never thought to make that transition. It's pretty interesting, creative, I guess. We all have to be that way.
Yeah, definitely.
Good. Well, again, thank you. I appreciate your perspective. But again, knowing that your office is out there, your shop is out there doing what they can to make sure that your services are known to the folks in those particular living arrangements.
Yes.
So good. You already said you're going to update your information, so thank you in advance for doing that. Our next guest is Joe Betancourt. And Joe, I'm not going to put the title because they're all different in front of you, whether it's pastor, reverend. But every year we reach out to our faith community during the National Elder Abuse Awareness Day, because a lot of things happen behind the scenes with church families. They're very, very strong on many, many fronts. And we're pleased to have you here as a new guest to give us your perspective of how things are in the faith community supporting your family, your church family in these difficult times. So I'll mute and allow you to let us know what's happening in your world.
Thank you, Patrick. Good morning, everybody. And I'm pleased to be a part of this Elder Abuse Prevention Roundtable event and to represent the faith-based community in Greater Portland. The GO team and GO stands for Generosity Outreach, at East Point Christian Church in South Portland is a dedicated financial resource for individuals outside of the church in the greater Portland community. Just a note, we have a separate benevolence program to help those who attend and are part of our church. The GO team at East Point works exclusively through 250 plus social service providers that have attended one of our GO team provider orientations. After they have attended our orientation, we partner with them to help their clients towards betterment and stability. Please note, during COVID-19, we have done all of our meetings together as a GO team and with our GO team partners and providers via Zoom. Providers have many financial tools and services available to them to benefit their clients. The GO team is a last resort for those individuals who seem to fall through the cracks in the system. Jesus told us to assist the poor and love our neighbors. Working with social service providers helps us to get financial resources directly to those who are most needy. Because social service providers have a personal relationship with their clients, we indirectly receive the benefits of that relationship. Our GO team goal is to help move an individual or family to move towards betterment and financial stability. Life is inherently messy. Even with a lifetime of valuable experiences, our seniors can be vulnerable too. Elder abuse can be experienced in many forms. I would like to share a couple of stories of elderly people we have helped who have experienced trauma in their lives. Both examples are a result of having to make a difficult move. Please note, a move to a new location can in itself be one of the most traumatic experiences that a human being experiences. The first story is of a 69-year-old woman we helped. She lived in the same apartment with the same landlord for over 8 years, with consistent rental payment and as a reliable tenant. She did receive some housing support from the city, as well as several other benefits from the state. Her landlord sold the building to a new landlord who demanded she vacate immediately. Because of this severe stressor, she suffered 2 strokes, which impeded her ability to move physically. The new landlord was undeterred and insisted she move, even though she was under duress and physically incapacitated. Fortunately, she received legal support from Pine Tree Legal to win a case for extension of the forced expulsion from her apartment. However, her new landlord continued to pressure her to leave, and she experienced 2 additional strokes and resulting infections. 1 year later, she was able to physically make the move to a new apartment that she could afford. However, she did not have the financial resources to hire a professional mover. She applied to the GO team at East Point through her social service provider for financial assistance for her moving expenses. Since this was a betterment situation and would contribute to her overall financial stability, we sent a check for $990 directly to the professional mover to cover her expense. The second story I'd like to share with you is a 75 and 76-year-old couple with no family or close friends. They lived in a mobile home for 21 years. They experienced severe financial hardship after she and her husband were involved in a car accident. Now they owed thousands of dollars to the insurance company and were without the use of a motor vehicle. They were dependent on neighbors for transportation. Unfortunately, the neighbors were taking advantage of them by charging them $50 per ride to take them 6 miles to the grocery store for shopping. Then the wife had a bad fall and broke her leg. As a result of these experiences, they were unable to keep up with expenses in maintaining their home. Their home of 21 years was officially condemned. It really looked like they were going to be homeless. Fortunately, with the help of their social service provider, they were able to locate another mobile home rental. However, they did not have the finances to afford all of the security deposit. The Go team paid the additional $650 needed to get them into their new rental. Now they were able to start focusing on their health and a fresh new start. The East Point Church has heartfelt love for the elderly population in our church and in the greater Portland community. Recently, they donated a $20,000 plus Easter offering to the Southern Maine Agency on Aging for a special project. SMAA provides a number of valuable services and is a great resource to our elderly population and community. Elder abuse can happen in very subtle and more obvious ways. It often affects them financially. The Go team at East Point Christian Church and our church members are pleased to be a part of the safety net for our seniors. Thank you very much, Patrick, for allowing me to share this with the group today. Thank you.
Joe, my thanks to you, and I'm not going to let you off the hook just yet, because what you're doing is truly inspiring for that group of people who would be, you are the safety net for these folks. And I'm intrigued that where else in the state of Maine are you aware of where these type of Go teams, do they exist outside of your catchment area? Do you know?
That's a question I'm not prepared for, and I really can't answer for you. So, I do think our approach is unique and different in that we work exclusively through social service providers, not directly with the client. And the bonus and the benefit to that is that the social service provider has a relationship and understands the whole picture. And that is, as a result of that, we would never have somebody coming in off the street asking for help. You don't get the whole picture, the whole story. But working directly and exclusively with social service providers gives that measure of really meeting the need that's truly out there.
It sounds like they act as a filter to bring to you. That way, your good deed, your efforts, you are almost 100% ensured that your gift to these folks will be used in the manner in which which they think it's going to be. Which I think, as we all know, we talk about scams, we talk about people who try to do things, put a face on here to get something for free or something that they don't really need. So let me ask you this one follow-up question. And I see there's a little bit of interest here in the chat, but would you call your program homegrown? You came up with it, your church came up with it, or is a model that you're following?
It's I should say that it's a model that we're following. There's a book entitled Toxic Charity, and within that, it describes a bunch of things that we were doing wrong prior to reading the book, not understanding the importance of the dignity of the individual client that's receiving the benefit, and a variety of other topics. So we've kind of followed that. We call it the oath of compassion that he clearly defines there. And the most important thing we try to do is to do no harm. And so any benefit that we do is a one-time benefit to that individual client. It's not something that they can reapply for again and again, because the goal is to, with the financial resource and that one-time help, that establishes betterment and stability for the individual client.
That's very helpful. Are you able to disclose who the social services groups that you work with in your community, so maybe we can figure out if somebody's interested in this, let's call it a project in some other portion of the state, who's at your table, or whose table do you join for this social net? And there may be people on the call already, but are you able to tell us who that is?
Well, we do have two Go Team partners or providers in the Elder Abuse Group Institute, but we primarily are connected with the CPPC, the former CPPC network in the Greater Portland area, with the Opportunity Alliance, Sweetser, Spurwink. So a lot to do with children, children's services and children's social service providers. The church seems to have a real heart for the real young, particularly high school kids that are homeless, and the real old. Like I said, we dedicated a whole Easter offering to SMAA, which is a fabulous group, Southern Maine Agency on Aging. They have some real saints that work in that organization that do just great work.
Yeah, a lot of us are familiar with the area agencies on aging within our communities, and you're right, they do a lot of that grassroots work that it's perfect niche for a lot of our community members. Joe, would you be the point of contact for those of us who would like follow-up information, or is there someone else within your church that we might be able to contact?
I'm going to, after this chat, put on the chat list, there's a dedicated email address for the Go Team. Go Team is a 7-member group that doesn't report to the church any of the conversations that we have with our social service providers, because having that a safe and secure conversation with our providers and about their clients has to stay within that network. So I'm going to put this Go Team email address on the chat that any provider can contact the 7-member group with just one email, if that works for you, Patrick.
That is absolutely perfect fit for that.
Yep.
And Joe, I just want to thank you for joining us. I don't know, it's a perfect fit for the perfect time with our faith community. So thank you for the good work you're doing, and in the fact that you took a few minutes to join us today. I think it's truly impressive what you folks are pulling off right now.
All right, thank you so much for the opportunity. Thank you.
You're welcome. So we're going to make one small change on our schedule. Our very last guest of the day had another commitment. So we're going to open this up for the next few minutes, however long it takes, no more than 20, so we stay on track. But just some general questions on either to the guests that we've had so far, maybe to the elder abuse, the Maine Council for Elder Abuse members that are here, even the Education and Awareness Committee. But is there anything that a question, I think probably the easiest way is to write that in the chat, and we'll do our best to go down through. And if there's a person who's best to answer, we may invite them to do that. And if they're just not comfortable doing that, we can have an offline conversation through email. But we've got a few minutes if somebody would like to take advantage. It looks like we have 100 people attending, which is fantastic. So there must be a burning question out there that we can.
Yeah, Pat, folks have been putting in some questions throughout, and then they've also been getting some of those questions answered right here in the chat. So thank you to our speakers for that. But there is a question for Trinity that I don't see has been answered. Trinity, this question is, are you finding that your calls for help have gone up, down, or stayed the same? And also, have home care services been able to continue as normal during the pandemic?
Yeah, so our calls have increased a lot because we're seeing our typical complaints and concerns from residents and their families. And then we have COVID concerns and complaints on top of that. So our calls have certainly increased. Our intake worker, who handles all of our incoming calls, has been stretched thin. Regional ombudsmen and our management are helping with those calls as well. And as far as home care, I don't cover home care personally as an ombudsman, so I can't speak to that exactly. And I don't think our regional ombudsman for home care is on here, but home care is always a difficult place to staff. I know that everywhere is difficult to staff in the medical field right now and all the time, but home care is always most difficult. I don't know that we have had an increase or if it stayed the same. I'm going to assume it's at least stayed the same, but yeah, I can't answer that exactly.
Thanks. And then we have a question from Andrew, and I think this is one for perhaps a wide variety of folks. Any of our speakers or any of our council members can speak to this if you have information, and anyone on the call, feel free to add in information in the chat. But Andrew's asking, today's presenters have shared multiple stories in which housing insecurity plays a major role in creating the conditions for elderly exploitation and vulnerability. I see the same in my cases at Legal Services for the Elderly. Is anything being done at the policy level to address the scarcity of affordable, safe housing, or at least research to investigate the connection between housing insecurity and elder abuse? If any of our speakers who want to speak to that. Oh, Patty,
Sorry.
are you there? You
Yeah.
go.
Sorry, I was trying to find myself again, which isn't always easy. I would just say that it's really interesting that this, Andrew, that you brought this up, because we're as part of our project with ACL, we're looking at how we measure success for the clients that we work with and how we assess risk. And so we were having this exact conversation just yesterday about housing insecurity as a risk factor for the clients, how often that is true for the clients that we work with, that they are in a period of transition, and whether, whatever that housing transition looks like, how that presents itself as a risk, what we perceive as a risk, maybe not what the client sees as a risk. So we're looking at how we collect data around that right now, Andrew, and would love to have that conversation, because I think it's really very true. Didn't want to offer any other than just, yeah, I mean, yes, it's an issue.
I know that there's a lot of work being done from my work at the Maine Coalition to End Domestic Violence, a lot of work being done around the lack of safe and affordable housing generally, and how that impacts victims of domestic abuse and violence across the lifespan. I can't speak to specific policy sort of pieces of work right now, but it's definitely a thing that my colleagues are working to move forward. I just don't have more specific information either. But there's certainly an active effort in Maine to address that gap, for sure.
Yeah, and Regina, Katie just noted in the chat, the Elder Abuse Coordinating Partnership, with which our agency is fortunate to be a part of, is looking at, we just completed a survey. It looks at direct services, policy, education and outreach, and data collection and research. And I know that when we completed our portion of the survey, housing was something that we brought forward to that group. So I think Katie, you're absolutely right. That's a great place for that conversation to happen. Absolutely.
Are there other questions that folks have for our speakers? I have a question, and I am empowered to talk. It seems like another theme that I've heard from folks a couple times is the need over the past year to use funding in a different way than you had perhaps thought that you would need to use it for, because COVID changed everything. So you weren't, I think one of our speakers said, going to that conference, right? So instead we're going to do this set of PSAs. And I'm just curious if any of our speakers have a perspective on the importance of that flexibility in funding, and if it's a continued need, like if people feel like that's a continued need to for funders to have some patience and flexibility with planning our programming, if there's a message that folks, recognizing everyone has a wide variety of funders, but is there a message for funders that you would want to give at this time? And the answer, no, we don't have a message, is also okay.
Katie, I wonder if folks have the ability to unmute themselves, and maybe Katie can tell us yes or no on that to respond, if that happens to be the situation.
They should be able to. We didn't want to broadcast it widely, but yes, you are in control of your mute button if you need it.
Regina, I'll answer that question because I think in asking it, you brought you sort of asked you did ask for flexibility in bringing forward that question, right? So absolutely, there is a I think there is a need for flexibility from funders, not just in how we're delivering services, but understanding that for some of us, for most of us, this is new territory and we're learning things. And so are there opportunities, and is this fun, you know, is this an opportunity for funders to look back to their fundees, their grantees, and ask what they're learning in this time and how that can impact practice post-COVID. I also would say that, you know, I'm sure a lot of us share, those of us who receive funding from different sources share that they're not just the service delivery requirements have shifted, but also the reporting requirements. I think, interestingly, I'm sure this is also shared by people that were super busy. And so if reporting requirements haven't changed, that would be a call I would, you know, that would be sort of a, if there could be some leniency, not just in the flexibility for service delivery, but also in some cases they've gone up as opposed to going down.
Regina, if you think that wraps up at least this first little portion of questions, we can move to our scheduled break. We've got 15 minutes scheduled for you to do just that. As a reminder, please don't log out. I think that's going to create some difficulty getting back in, but feel free to mute your audio and also your video. But we'll plan to be back here in exactly 15 minutes. So if you would take your break as you would, and we'll be back and see you soon. So thank you very much. Kate, I was going to give you the warm handoff, but you beat me to it. So, right, welcome back, everybody. We'll continue where we left off. Our next panelist will be Katie Condrat from Mikasa, who's going to share what things look like in their world right now.
All right. Thank you so much. Thank you all for your time, for being here, and for being a part of this conversation. I find this roundtable and the annual summit so valuable because of the amount of expertise all of the various partners and participants hold. We at the Maine Coalition Against Sexual Assault find that we can't do our work without these partnerships, without this other expertise, and without working in collaboration. And so what I wanted to go over today was a little bit about what the coalition is, what local sexual assault services centers provide, a little bit about the initiatives and strategies centers have used over the years to connect with older survivors of sexual violence, and then some of our observations around COVID, which I imagine will sound similar to ones we've heard before, but still. So the Maine Coalition Against Sexual Assault has 7 member centers, 7 local sexual assault support centers. So we don't provide direct services, but we support those who do. And we also play a role in statewide initiatives, education, training, such as this one, also policy and legislative advocacy. We work with local centers on creating shared tools, resources, networking, and training for those local centers. We also work closely with others providing sexual assault programs who may not be our membership, but are doing amazing work in communities. So Maine Transnet and the Wabanaki Women's Coalition, also sexual assault response coordinators in the military, Title IX, and you all who are also doing advocacy in your work and on the ground. So sexual assault support centers have been around for many years, and they all provide a helpline, 24-hour support. We've had a newer initiative that includes daytime text and chat possibilities. I'm going to share that information at the end, how you can get connected to that. Something we want to let folks know and remind them is that we support people who've experienced sexual violence across the lifespan and regardless of when the violence happened. So I know at these tables, we sometimes spend a fair amount of time talking about current threats, responding to a current crime of sexual violence or abuse, or looking at polyvictimization, or talking about more egregious forms of violence. But we also support people who experienced violence 30 years ago and are now ready to talk about it. So when you think about sexual assault support centers and the advocacy provided, we like to remember it's about things that happen now or in the past as well. Sexual assault support centers provide prevention education in schools to community partners and to educators. They provide professional education for those supporting sexual assault survivors in their work. So law enforcement, medical providers, clinicians, and folks working at elder serving agencies. And then there's also support and accompaniment for people as they navigate a system following sexual violence. So going with someone to make a police report, going to the hospital for medical care, going to seek other services, in addition to options for healing connected to mental health care, support groups provided by the centers, and other resources such as that. There's been an increase in outreach over the past handful of years. Outreach we think of as going to communities who are otherwise isolated or have barriers to services, and really building relationships with populations and with population serving providers, such as people supporting older adults. It also looks like doing outreach at shelters and jails, youth programs, that sort of thing. So some of the specific initiatives and strategies that centers have used throughout the state, they vary center to center, like based on capacity, partnerships, expertise. But over the past handful of years, it's looked like sexual assault support centers being on elder abuse triads or task force, doing outreach with posters and materials in community spaces designed for older adults, training anyone on the considerations for sexual violence in older adults, connecting with local APS whenever possible, and some of the newer programs have also been outreach to residential facilities or subsidized housing geared towards older adults with education, There was one agency that partnered their outreach advocate and their prevention advocate to bring information to older adults around what training was happening in schools around sexual assault prevention as a way for older people to talk to the younger people in their lives, and also maybe create an opportunity for conversation, for disclosure, for building trust. And then, of course, participating in things like that, coming to summits, the roundtables, and community education opportunities. Within COVID, all sexual assault support centers are continuing to provide services. It's just more on the phone than in person. Some centers, based on prevalence of cases and agency decisions, did not stop accompaniment, continued to go to medical exams and police interviews, but some chose to do those via phone during COVID. Similar to other folks, we saw a decrease in calls to the helpline and services provided in the first half of the year, a drop by about 30%. And we saw a drop in services to folks over 60, even more than that, a little bit higher, more like 40%. And some of the adaptations during COVID have been coordinating with Meals on Wheels to distribute materials, continuing to deliver outreach materials to facilities, even if folks can't go in, and then continuing to stay connected to those partnerships that had been established in person, but now need to happen over the phone, and continuing to provide training via Zoom. What I think this has highlighted for sexual assault support centers is the value and importance of our partnerships with you all. That bridge to referrals, that someone who is trusted, who receives a disclosure, understands that sexual assault support centers are available for asking questions, for supporting that person in their decisions and next steps around what to do, more information, and just ongoing support. And so while we already value those partnerships, during this time where folks can't be doing outreach in quite the same way, we invite all of you to reach out to your local sexual assault center to talk through, when do I make a referral? Should I get a training? Do you have any materials that I should have? And so sort of talking about what that bridge to support and services can look like. And I think that was it. And you can also reach out to me if you don't know who your local sexual assault support center is. You can reach out to me. We're helping build a training for APS caseworkers, which is a great foundational training for really anyone wanting to talk about considerations for older adult survivors experiencing sexual violence. So if you have any questions or interest in connecting more, just let me know.
Thank you, Katie. I have one question for you, not to put you on the spot, but I'm certain you could probably answer it. As a parent with two kids that have a new hybrid schedule, what are you hearing about the centers connecting with students across all age ranges across our state? Has that ceased? Do they try to use technology? Do you have a sense of what's happening?
For young folks, it's interesting you bring that up, because when we first, here, I have to spell myself again. We had a bunch of statewide calls, right? When COVID first started and everyone was sent home and schools were shut down, and talking to advocates about what their concerns are, what do we do next? How are people adapting programming? And some of the time we spent was holding space for the real anxiety and heartache that was thinking about people who were home with caregivers who were potentially abusive and with no real means to connect. So usually depending on schools and eyes on kids, the same way depending on access to institutions and programming and support of older adults, these folks who are otherwise isolated and have no connection to services. So there was a lot of conversation and strategizing around if connecting with young folks via the internet was actually the means, or if it was about building the toolkit of the adults in their lives. And that, I think, is where the prevention folks are going. In the same way, it's about thinking about you all as a bridge to support and services, and how can we provide more tools and information around sexual violence identification and a response to response to disclosures, if that makes sense.
Yeah, absolutely. Thank you for fielding that well. It's all different, but it's using those tools that we have and are all becoming more comfortable with it. So again, thank you for the work that you're doing out there and supporting the 7 other centers. So our next guest is working at Through These Doors. It's Elise Barakagrira. She's going to tell us what things look like at Through These Doors, and I will mute myself as soon as I see her pop on the screen.
Yeah, thank you, Patrick, for the introduction. Unfortunately, my internet is very unstable, and I find it helpful if I keep my video off. If that is okay with you. So my name is Elise. I am the Abuse in Later Life advocate Through These Doors. We are a domestic violence resource center, providing a full array of services to people experiencing domestic violence and related issues. We offer community education, prevention, and training on domestic abuse to Cumberland County residents and engage in efforts to hold offenders of abuse accountable for their actions. We do community outreach, but unfortunately, due to COVID, we don't do that the way we used to do that. We do have 3 outreach offices, one in Portland, the other one in Midcoast, and another one in Bridgeton area. So our core value is our 24/7 helpline. That's where we connect with survivors and victims. We also have get referrals through the partnership of Cumberland County police departments and sheriffs. We do receive all the police reports that involves domestic abuse, so then we can do follow-ups. We also get referrals through our court system and of course throughout our community partners throughout Cumberland County. So what I'm seeing right now during the time of COVID, things have changed. I would say that we all know that the more we age, the more isolated we are. And the COVID has added more challenge to that. But as advocate, we have been able to be present as much as we could. And of course, our time spent on phone had gone up 3 times. Before the pandemic, I'll be on the phone for maybe 30-minute conversation, but right now I can find myself having a conversation with a victim or survivor for 2 hours. And you can imagine it's because we are the only person who are able to reach out and listen to them and safety plan and meet them where they're at. So it has been challenging for them to access services that they've been able to do that, such as navigating court system. And we have been able to step in while maintaining our safety. Prior to the pandemic, we were fully present to court to help victims of domestic violence to fight a protection from abuse orders. But now we do that face-to-face situation. If we see that someone cannot navigate those services without our physical presence, we can certainly allow that. So it has been challenged for the elderly who are being abused either by their intimate partner or family members or caregiver to come out because of the fear of being alone. We have been focusing on safety planning and let them define what safety is, either to maintain their home with the abusive partner or family member. And if that is what is working for them, we can safety plan around that. and have them have the voice to define what safety is. We do that with understanding, because these are difficult decisions to make if they decide to file a protection order, and have them separate with those who are abusing them, especially if they're their kids, their grandchildren. These are hard time. It has been a hard time for the elderly to make that decision. But we do that with the understanding and respect, because these are victims' decisions. We are not there to tell them what to do. We support their choice. So, and we cannot do that without collaboration. We collaborate with other professionals, either faith leaders, advocate, aging network, protective services, and health professionals, friends and attorneys, and family members. We cannot do this and keep our elders safe without the partnership with all of you. And I will encourage you to keep doing that. If you see that, reach out to us and we can safety plan around the situation. Thank you so much.
Elise, thank you very much for your look into the domestic violence portion of what our partnerships look like. And we see, at least in the law enforcement side, several more high-risk domestic violence plans, so that we're all in the loop because of maybe some different things that have happened in our criminal justice system due to COVID. So I think your role and everyone else's role in your shoes throughout the state is important. And I did ask a question in the chat about those phone calls, those ones that you may have typically a half an hour, but now all of a sudden, hold on, they're 2 hours in length. And my question to the attendees is anyone else seeing that type of increased call for that, call it support, because they're not talking with anyone? So maybe we'll watch that as it pops up through the chat, but that may be their only way to connect outside to other people safely during these times. All right, we'll move on to our next guest. It's Vanessa Medor from Maine Savings, and she's going to let us know what things look like at her or just general financial institutions during COVID. So Vanessa, to you.
Good morning. Thank you very much for having me. My goal this morning is to discuss with all of you the outreach initiatives that we instituted during COVID as an inspiration from all of the hard work that you have done over the years, but also to share with you some of the trends and patterns that we've seen in the banking industry, specifically credit unions, but this also affected all community banks, credit unions, and the national banks as well. As most institutions, financial institutions, closed their lobbies in mid-March with the emergence of the pandemic, many remain closed well into the summer months. We closed mid-March. We reopened for teller transactions only in mid-July. Our lobby offices do remain closed today, but available by appointment. It's a common theme and trend that you find in the financial institution industry. During the branch lobby closure, we increased our service offerings for all of our branch drive-through locations. This was not something available for all banks and communities and credit unions throughout the country or even regionally. We were fortunate to do that. This afforded our members full access to every service, as well as all of their monies at any time that they needed to. We even extended our business hours. One of the challenges that this presented, of course, for many of the communities that we serve, those members that came in daily, weekly, monthly, that we connected with. We knew their stories. We got to visit with them on the 1st and the 3rd of the month for their Social Security, their VA benefits that came in. These individuals, these older Mainers, were now challenged. How do they communicate? How do they reach out to us? Their comfort was coming in, again, daily or weekly or monthly, into the lobbies. They did their best to adapt to the drive-throughs, which we had available. Instead of call volumes increasing, the length of time for drive-through wait was significant. It was not unusual from the first and the third of the month to be in the drive-through lane for upwards of 2 hours to connect with your local financial institution teller, to connect on a personal level and do your banking. While it led to some frustration, it ultimately led to a wonderful connection. It allowed us to continue to see and keep track of these older Mainers who are our members. But in those instances where those people didn't adjust and adapt and didn't come to the drive-through, we decided we needed to do an outreach calling campaign. We serve a number of communities that span as far north as Milo, to the coast to Ellsworth and Bar Harbor, and as far south as Portland. And in some of those communities, we might be the only financial institution in town. Our branch managers, our tellers, our service reps were instrumental in doing outreach campaigns. They made a list of those older Mainers who are members that they were missing seeing daily, weekly, or monthly, and gave them a call. And overwhelmingly, the members were overjoyed to hear from a friendly voice. We checked in with them, asked how they were doing. Were there any issues that they had, anything that they needed? They lived in very tight communities. And for the most part, these individuals were well served by their friendly family, their neighbors, and also the other community organizations that service their needs. They were able to have access to food, transportation to medical appointments, and anything else that was needed. In those few occasions where when we did place a phone call and we were met with a disconnected number or someone that never returned a call, we did reach out to local law enforcement to ask them to conduct wellness checks. In a few rare instances where the tellers were so well connected with the individual, they went out in pairs and actually did their own wellness checks. We were very fortunate that ultimately this led to good news and positive outcomes. We had very few issues that needed to be addressed by law enforcement, medical personnel, or even referrals to APS. As we continue to live through this pandemic and adapt our services to meet the needs of our members, we continue to educate and support our employees to advocate for our members. We encourage and support our employees in their initiatives to stay connected in any possible way, especially in those communities and for those individuals at higher risk. Something that has become incredibly disturbing for us and really unfortunate is the uptick in scams and fraud that really are targeting our members who are older Mainers. The romance scam has been around for basically as old as time. The way it comes about changes a little bit. It targets our members who are isolated, who are lonely, and who are vulnerable. They have found comfort through the online relationship. And almost always this results in a romance scam. COVID has given fraudsters an unprecedented amount of time, over 6 months, to develop these intimate and apparently trusting relationships with a vulnerable member. It culminates in the member unknowingly being taken advantage of to participate in fraudulent movement of money. The fraudster has the member receive a fraudulent check and then go out and purchase a Visa gift card or a MasterCard gift card, and they send these cards in the mail to the fraudster. They may even return the call and scratch that wonderful foil on the back of the card, giving them the information, so now those funds are activated. In all of these instances, we term that person the fraudster, our member the victim. But our member experiences a relationship, that this is their boyfriend, this is their girlfriend, this is their fiance, this is someone they have established a trusting relationship with. We are not the trusted entity. The person on the other end of that text, that Facebook message, that email is the person that they rely upon. It's a unique challenge for us and something we strive very hard to explain to the member when we're faced with these challenging situations. It is unfortunate the larger dollar amounts are often conducted through wires and automatic deposits. Members are instructed to withdraw the funds to send money orders, Western Unions, or wires. Ultimately, this makes the member an unknowing money mule, a person who unknowingly moves illegal funds through the legal banking and business channels. One profound story for us occurred during COVID, and it happened to be a combined scam from a work from home scam along with unemployment fraud. Many of our members fell on hard times during the pandemic and continue to struggle with meager or no income. There was a great desire to supplement the loss of income, and they turned to online job offerings. Unfortunately, unbeknownst to them, these were posted by fraudsters with the intent of capturing individuals to be money mules. In this instance, the member accepted a part-time position with a Florida-based limited liability company. Her job was simply to invest funds for the startup company. She received direct deposits from PayPal, the Cash App, several national banks in terms of direct deposits and wires, as well as unemployment funds from 7 different states in the names of as many different individuals as you can imagine. Each time she received the funds, she was instructed to convert the money into Bitcoin and send it to another location. This went on for a period of several months. The fraudsters know the actual limits that institutions review. Therefore, they kept everything below the threshold, so we were not made aware of the situation. She was earning a little bit, as much as $50 to $100 per transaction, enough to supplement her income. Whether it was intentional or not, there was one large transaction that certainly flagged, and that's how we were made aware of the situation. When we dug into it, we realized that over the course of several months, she had moved over $55,000. Fortunately, she was willing to listen to us. We connected her with local law enforcement, and she's been able to assist in the investigation to catch the criminals. We as a financial institution daily have increased our proactive measures. We review daily reports that we created based on the red flags and the current trends that we have found that are particularly victimizing our members. We review all incoming and outgoing wires for trends and patterns and red flags, typically elements that would be consistent with the fraud we've experienced, especially for those vulnerable members, our older Mainers. So we look at an outgoing foreign wire. This might be something of a red flag, and its purpose is an undisclosed purpose. And it's sent out after receiving a large wire or direct deposit. It came into an account that has had limited activity or virtually no funds. We reach out to the member. We ask them who this person is they're sending the wire to. We get as close to them in our verbal conversation as we can to ferret out the true intent. 9 times out of 10, it is fraud, and we are able to help that member dispel that belief that that person truly cares about them. They certainly wouldn't defraud them if they cared about them. And in most of the instances, we're able to get the member to work with us so we prevent any losses. In conclusion, we continue to educate our members regarding the scams and the fraud that we see. We educate our employees as well. We expect that our employees ask the tough questions of our members, especially those that are highly vulnerable. We encourage and support our employees to conduct member outreach initiatives in any creative way that they find possible. Thank you very much.
Vanessa, awesome. Bottom line, awesome with the work you're doing and your staff. And I know you are one of many financial institutions across the state, and I hope that that is replicated 100 times over. But if you are the bar, let everyone come to the bar that your financial institution is doing, because again, it's those relationships that especially the population we serve are so near and dear both ways. And it's just good to hear that kind of work. So thank you very much for that, Vanessa. Very, very powerful.
Thank you.
So our next speaker, it's Lori Johnson, and she is representing and works for Seniors Plus, and she's going to share some information with us.
There. Hi, can you hear me?
Yes.
Good. Okay, thank you. So yes, my name is Lori Johnson. I'm here representing Seniors Plus. We are an area agency on aging. In the state of Maine, there are 5 of us, and we all cover different counties. Seniors Plus covers Androscoggin, Franklin, and Oxford counties. In a nutshell, our mission is to keep people in their homes for as long as possible, as safely as possible. My plan today is just to talk to you guys a little bit about each of our programs, the changes that we've had to make due to COVID-19. I would say literally every single program that we offer has been affected by this, the way that we provide the service. All of our staff is working remotely at this time. And it's been challenging for sure, but it's also pushed us to make changes to our programs that really have made them more accessible to people. So I will just say that across the board at this time, Seniors Plus continues to be closed to the public for face-to-face services until further notices. And we aren't first responders to elder abuse, but we are mandated reporters. We do refer people out as appropriate. And when I go through our programs, you'll see that a lot of them are really geared towards just prevention of elder abuse. So I'll dive in. I'm going to start with our nutrition programs. We have 3 of them. The most well-known is our Meals on Wheels program. People that are eligible for meals within our catchment area are able to access meals 5 days a week, sometimes 7, depending on their eligibility. Meals are not just a nutritious meal coming to people's doors, but it's also a wellness check in a lot of scenarios and a brief opportunity for socialization. Pre-COVID, we were able to deliver meals right to somebody's door, hand off the meal, and have a short conversation. Now, what it's looking like is our delivery drivers are all wearing masks. They're knocking on the client's doors, setting the meal down, stepping back to maintain social distance, and then waiting until the person comes to pick up the meal. And we don't leave until they come and pick up the meal. If they don't come answer their door, then we make a phone call to them in their house for them to come to the door or to their emergency contact. Pre-COVID, we were delivering about 2,500 meals a week. Now it's about 4,000 meals a week. It's increased tremendously. We've also lost a lot of our volunteers due to COVID-19, people not wanting to be in that scenario and put people at risk. But the good thing is that we have had the opportunity to expand eligibility through different funding sources. So I would just say, if you know somebody within the 3 counties that we cover or across the state, other AAAs offer Meals on Wheels as well. If you know somebody that can benefit from Meals on Wheels, just call us and we can have the conversation about what they're eligible for and what their delivery days look like. The next program is our social dining. Social dining is where we would have people gather together and eat meals in different locations throughout the counties that we cover. Currently, obviously, we've had to close down our social dining sites due to COVID-19. And what we've done is offer Meals on Wheels to the people that used to participate in their social dining. Not everybody takes us up on that opportunity, but we've had about 40 people that have. Around Town Cafes. This is a program where we've partnered with 8 different restaurants throughout the 3 counties that we cover. And people that are over the age of 60 can purchase a voucher. It's a suggested donation of $6 per voucher. And then they can take that voucher to a partnered restaurant and get a meal off of the Seniors Plus menu. I believe there are 3 restaurants out of the 8 that are not accepting vouchers at this time due to COVID. But it's still happening. It's a super popular program and it gets people out and they get a good meal. Information and assistance is a huge part of who we are and what we do. And this is just literally, we know resources. We know our programs and services, but we also try to know all the other resources that are available to people. So people call and they have questions about transportation. They have questions about home care and how to access it, insurance questions, you name it. And our job is to connect them with those resources. If a resource doesn't exist, we try to find a resource that can help them. A lot of people need help with applications. We help with applications. And of course, that's even more difficult where we're not doing face-to-face. So like a lot of people that have already spoke, our conversations are taking a lot longer because typically we would have a face-to-face appointment with somebody, help them fill out an application, so on and so forth. Another part of our information and assistance is people call and they don't really know what they need, but maybe they're in a financial hardship. So for instance, somebody calls and they need to put oil in their tank for the winter and they can't afford that. And maybe they're not eligible for LIHEAP. What we would do in that scenario is what we call a benefit checkup. So we know state benefits, we know community benefits, and we do a screening to see what people are available or eligible for. And we will help them apply for that benefit if they need that assistance. And what happens typically is people don't know what programs are available. They don't know if they're eligible. They don't know how to apply. And once they do get that information and they do apply for these programs, a lot of them supplement your income. So it keeps money in that person's pocket in a lot of scenarios, and then they can take that money and go and purchase oil for the winter. So we do a lot of the benefit checkups for folks to just make sure that they're getting things that they're eligible for across the state. Medicare, we help with Medicare. We have certified Medicare counselors. We have 7 volunteers. We have 6 staff. And we just help with anything Medicare. So people that are new to Medicare, or people that just have a question about their package, or maybe they have a Part D plan, a drug plan that maybe used to cover a prescription of theirs, but now doesn't cover a prescription of theirs, and what do we do? Anything Medicare, we can sit down and, well, not sit down face to face now, but over the phone, have a conversation with them about their Medicare. As you guys are probably aware, Medicare is a beast and it's confusing. And so we're here to help people navigate that system. Due to, right now we're in the midst of open enrollment for Medicare. This is the time that people can make changes to their plans. Open enrollment has always been very, very busy for the AAAs. Now, because we've had to really revamp everything we're doing in order to provide good service, there's a lot of changes and it's super busy, but I think that it is going really well. It's going really well. We're helping a lot of people. We can help people over the phone. We've created a lot of documents that we can mail to people or send them via email that they can fill out and send back to us. And then we're also doing a lot of video conference platforms with people to navigate their Medicare. Caregiver services, we have several programs for caregivers. When I say caregivers, I'm talking specifically about people that are caring for somebody that has a form of dementia, Alzheimer's or dementia. We have a respite program, which in essence is a program where we're able to reimburse somebody for the money that they're paying out to receive respite services. The good thing about the respite program is that the person can hire whoever they want. It can be a friend, it can be a neighbor, it can be a family member, it can be somebody from a home care agency, and get that respite. And what they'll do is they'll send us documents periodically throughout the year, and we're able to reimburse a portion of the money that they've spent out for that respite service. Our respite service is going really well. However, there are a lot of people, not a lot, but there are some caregivers that have been put on hold because they don't want people coming in their homes due to COVID at this point. So that's a thing. We have caregiver support groups. They used to be in person. Now they're via Zoom. We offer them twice a month. They're pretty well attended. However, we have noticed that it's hard for caregivers to speak freely during a support group in their home with their loved one there. So we've had to kind of revamp that as well. So now not only are we offering support groups via Zoom, but we also have a monthly newsletter that we're putting out to folks with resources and information and interesting articles. But we're also doing monthly check-ins to caregivers that opt into that, where we'll have a licensed social worker call them and just see how they're doing. We also offer a class called Savvy Caregiver. It's a 6-week class. It's free. It runs once a week for 2 hours at a time. It's for these caregivers that are caregiving for somebody that has a form of dementia, and it's an evidence-based program. So it's been proven to decrease the burnout rate for people that are caregiving at that capacity. And what it does is it teaches people all about what is Alzheimer's, what's dementia, how does it typically progress, what resources are available for them, how to figure out what your supports, how to plan ahead, what your support system is going to look like, and then gives them some skills and kind of a bag of tools to be a better caregiver. It's a hard job, and the burnout rate is huge. So this class is it's great. People take it over and over again sometimes, and we are offering that through Zoom currently. Education is a huge part of what Seniors Plus does. We have recently joined a joint partnership with 2 other agencies on aging, Spectrum Generations and the Aroostook Agency on Aging, to make up Healthy Living for Me. And Healthy Living for Me is, the goal is to increase accessibility and availability of evidence-based programs statewide. And we're currently offering classes through Zoom. And those classes include chronic pain and disease management, diabetes prevention and self-management, and Tai Chi for health and better and balance. So there's a lot of other evidence-based programs through Healthy Living for Me. I would encourage you to check out their website. You can literally type in your zip code and see what's going on near you, and the offerings across the state. We also have an education center. So in our Lewiston office, we were offering a variety of classes. We got volunteers to come in and teach different workshops, have different presentations to our public. Of course, we're closed to the public right now, but a lot of the offerings that we did have, we are doing again through Zoom. So our education isn't open, but we do have education available through Zoom. Some examples of the classes, we have a Zoom 101 that we run. I think it's every other week currently. It's always packed. People want to join and learn how to use Zoom. Medicare Made Simple, just the ins and outs of Medicare, the basics of Medicare. We do total strength and balance, and then we also have a virtual knitting group. So it changes month to month, but there's always education opportunities available, and they're listed on our website if anybody's interested. Our Money Minders program, this has been it's a good program. It's still happening. It was there was some hiccups initially when COVID started, so Money Minders is where we have volunteers matched with clients to help them with their bill paying process every month, maybe once a month, maybe twice a month, based on the need. The volunteer would create like a budget, help the person open their mail, and make sure that they're getting their bills paid timely and correctly. A lot of the people that utilize that program either are visually impaired, or maybe they have arthritis and they're not able to open it or sign their checks. So Money Minders has been a great program. Due to COVID, I would say the first 2 to 3 months, it was kind of put on hold because it was volunteers going into people's homes. Now we have volunteers going and meeting with people outside with PPE, sometimes taking the information and sitting in their car and doing what they need to do, and then going and passing it back to the client. But it's a great program. We're able to be aware of different scams that might be occurring, and financial exploitation that also might be occurring. And we have 2 more programs that are fairly new. We were able, through grant funding, to purchase iPads. And it's amazing because we are able to offer these to clients that either on a long-term basis or a short-term basis to access our classes, or reach out to their family, or do telehealth, or whatever it is that they need. There's a short survey that they have to fill out, so we have an understanding of how much support they're going to need in order to learn how to use the iPad. And then there's the agreement form that they have to sign off on, but then they have an iPad. We mail it to them, and then when they're done, they can either drop it off or they can mail it back. But we have iPads available to people so that they can stay connected and fight that isolation. And then the last thing is a friendly caller program. So we had a ton of volunteers that were helping us with administrative tasks, but because we're closed, we don't have a need for those volunteers in that capacity. So what we've done is we've transferred them over, and they're making calls weekly to people that are identified to have that need. So they're doing weekly check-ins and just having conversations with people that can't get out and are isolated. We are looking for ways to sustain that program even when things get back to normal, but it's been great so far. So so that's us in a nutshell. I'm welcome to any questions, and I appreciate the opportunity to talk.
Lori, you're a prime example, not you, but your agency and across the state, of how much continued busy work is occurring when so many other segments have maybe slowed down or even shut down. But again, the value of this group coming together saying, hey, listen, we're busy and probably busier now than we ever have been. But money minders, I did see that come up in the chat previously, if people have questions about that. But you talk about a safety net. A lot of what you just said are just tools and programs to make sure that is in place during these crazy times. In the normal, I'm ready for it. No doubt about it. So Lori, thank you very much. And before I introduce our final speaker, who is Angela Hamlin, I think the way this will work is after Angela is done, if there are questions that folks have, and I know we have quite a bit in there now, Regina, I'll have you run down those. But if you'd like to add some of those questions now, so we can be prepared for them for the interest of time, we'll pick those up before we move into our final closing comments. So Angela from Legal Services the Elderly, the floor is yours.
Hi, everybody. Hopefully you can hear me okay. I have the two system going with the video and the audio separate, which is one of the things I discovered when I was setting up remote hearings. So we haven't closed. We never closed. Thanks to our awesome leadership, we seamlessly transitioned to working from home. So our entire staff is working from home, and we are still taking calls. We're still doing all of the legal work that we were doing before. The biggest change is that the court did close, and the court then had a bunch of rules about safely attending court and when that would be a good idea to do so. And so at the very beginning, I'd say my legal strategy was just getting everything continued, because that just seemed to be the easiest way to keep our clients safe. And as you guys all know, the increased risk to elders for catching COVID has made things even more difficult for them, and going to court is already scary for them. So on top of that, adding risking your health, it was just horrible. We've come a long way though. So now, so I've done lots of hearings via Zoom, and I've done some in-person hearings, but right now our way that we address cases, whether it's a eviction case, which we have a big increase of, or PFAs, or even our financial exploitation cases, is we're doing everything remotely. And unless there's a reason why we can't, and I can give you examples of why we wouldn't be able to, but for the most part, we are able to. Technology is probably the biggest reason that this is a struggle. A lot of our clients don't have iPads, and so I'm really happy to hear there are programs out there getting elderly connected to the internet and other sorts of services that way. One of the things I want you guys to know is I think you can always advocate for more safety procedures if your client's feeling hesitant for any reason going to the doctors, or it seems as though people are very open to outside the box suggestions to keep people safe, which is really wonderful. one of the tools we use to make sure that when we go to court, things are safe and people are following mandates is to have a status conference with the judge ahead of time, and just to make sure that everyone's aware that people should be as far away as possible and wearing their masks at all times, and also trying to limit how many people are in the courtroom. Traditionally, a lot of hearings included a lot of people. There might be 30, 40 people in a room, and depending on what courthouse you're in, you might be very close in contact with these people. And so now they'll give you your own time if you request it, which is what we tend to do, and then it's just you and your client, and then if it's on the phone, it's obviously just you and your client and the adverse party as well. And this is actually a good thing. I think, a lot of times you would sit around in court waiting for your time. Now you have a set time, which is wonderful. And then you go from there. One of the things also that we do that I'm not sure a lot of people, at least a lot of lawyers are doing, is making sure that both parties know that only the people should be there that are testifying. So no accompanying, girlfriends or neighbors, and just to really limit any sort of contact and spread. And then, so safe hearings is our number one goal. We do hearings for PFAs, PFHs, and FEDs right now, which is evictions, and they're both a little bit different, but they both require evidence to be submitted ahead of time, so it's a little bit more planning on the front end, but it ends up helping in the long term, and I think we all are feeling good. It's nice to kind of know how things are going to play out ahead of time if you have everything teed up and ready to go. Let's see here. As somebody else brought up, times are really hard for our elderly, but they're consistently getting their Social Security checks. A lot of them have secure housing, whether it's Section 8 or elder housing, or they own their home. And so for them, those two things are pretty stable for the most part. And then so we're seeing, family members who might be losing their homes moving in and needing to be evicted, or and it's just, it does make for a difficult situation because it is family a lot of the time, and it is very hard for the elder to stick up for themselves. So I'm glad everyone else seems to be aware that that is a dynamic that's going on. And I think for a long time, we're now in November, months and months went by where nobody was reporting anything because they were just trying to get through the time, and now people are finally coming forward and saying this is just not healthy for me or safe, and so we need to move forward and get the bad family member out of my home or get a protection order. Let's see what else. So Zoom is, as you can tell right now, sometimes it's good and there's problems, but for the most part, I haven't run into too many problems using Zoom. The courts quickly adapted, the clerks, and making sure that everyone has the links and ready to go. But obviously advocating and trying to figure out any details ahead of time is always a good idea. Asking lots of questions. Talking to your client a lot more than normal just because you don't have that in-person interaction. And I'm sure you guys feel this same way. I mean, I'm having hearings with clients I haven't met, just talked to, and it's a lot different because you learn so much from your client from meeting with them in person sometimes. But I've learned tools and tricks to get them to talk more about things that I want to know ahead of time. How have they been to court before? What are they most nervous about, and how do they react to stressful situations? I try to ask a lot more questions, trying to determine how they're going to handle being in front of the judge, even though it's remote. And so far, it's been really great. They take a lot of the notes, and they're ready to go as long as they have a support system too. So, when we rely upon a lot of our partner agencies like you guys to help us with this, I have noticed huge increase in collaboration with APS in my area, and referrals from the Area Agency on Aging. I just spoke with one yesterday, and then referrals also from the facilities themselves. And so this is great because they're knowing where to send people to get legal assistance. And in case I guess I didn't introduce myself, I am Angela Himlin. I'm an attorney at Legal Services for the Elderly. I cover Kennebec and Lincoln counties. I see lots of people that I know and recognize here, and it's so nice to see everybody. But we have attorneys all over the state, and we also have attorneys on the phone, and we have a Part D unit that does appeals for Part D and helps with Part D plans, similar to what Lori was saying they do for Medicare. And I think, I don't know what else more you want to hear about. I can talk certainly about challenges with remote hearings, or I can tell you, for example, the one time I did go to court in person, my client is hard of hearing, and she was not going to be able to participate remotely because she really needed those services the courts provide for people, you know, the reading prompt computer. So we had to arrange for that. And I know for a fact if I hadn't done the prep ahead of time that it would not have gone very smoothly. We may have lost our case because the opposing attorney was really strongly trying to influence my client, intimidate her by bringing in people. She was already super embarrassed and scared to be there. And we really were able to limit. The deputies were really great about not letting anyone in that shouldn't have been there. Another quick little, the court takes your temperature when you show up there, and they ask you all the questions like, have you been out of state? Have you been near anybody who's been out of state? So for any reason you guys are headed to court with a situation, just be aware that you won't be let in if you have been around anybody who's left the state in the past 14 days. And there's a whole series of questions, which I think you can find on their website. So they are taking this seriously, which is great. I have heard that some courts aren't as much as others, so you know, which makes challenges for us, but we just need to be working with the clerks and making sure we're doing the best we can to keep our clients safe. I mean, most of our clients have an underlying health condition on top of being elderly, so it's really such a value if we can get them not to have to put themselves in a risky situation. Also, I mean, a lot of our clients always had transportation problems, and because there are so few people to help out now, you know, that's another way we can still help those people. And also, you know, court is scary, and so if some people actually like being able to testify over the phone. The hearing thing is a little bit hard, and I'm sure you guys are running into that. You know, I have several clients who I communicate better with in person because I think they read my lips, and I use body language so they're able to understand a little bit more. And simply over the phone is very difficult. And with those clients, I've been trying to have family members who are available to sort of be there and help translate, or in like a nursing home like I was doing yesterday, like a social worker, with the client's permission, of course, to move all our cases ahead, because you know, the courts are going ahead. Everything is a little bit taking longer, but for the most part, we're, you know, going ahead as normal. And we, you know, what I think also I've been hearing from a lot of the presenters is the cases are just so much more intense than they were before, because the person, by the time they get to us with a legal problem, they've been dealing with this stressful situation for months and months and months, and they're at their breaking point. And it's just, you know, nobody is coming to us in like a calm situation with lots of concerns. So we're trying to handle all of that, and we really rely upon all of you guys to help us with that. And I just find my job so much easier if I have another community member who I know is helping with the situation, checking in on the client too, making sure they're getting their Meals on Wheels, or just being a support, because I can help with their legal problems, but they often have other ones, and it's just, you know, so frustrating when you can't help with the other ones as well, and you need to know who to turn to. So I hope you guys know about all of our services at Legal Services for the Elderly. We basically do anything civil, except for family law, and you just got to be 16 above, be a Maine resident, call our helpline, 1-800-750-5353, which I'll put in the chat here. And it's a pretty easy process. You talk to the paralegal, you get an intake, you get a helpline attorney, and if it's a case that we can assist with further, we will get assigned it. So, and it's everything from social security questions to, you know, evictions, which we're seeing a lot of, and financial exploitation and all kinds of things. So just any sort of legal question, I highly encourage you to have your client and call with them if you need to. And know that we're still here and we're still working and we're still busy, and we are finding new solutions. And it's just the biggest thing is if we can get in sooner, not wait till the last minute. I've been getting a lot of cases where there's already judgment entered, or there's already this decision made, and the town already owns the house, and it would just be much easier if you hear of somebody having a situation to have them call us, because we can do so much more quickly with the problem if we address it before it's nearly impossible to change. Not saying that you shouldn't encourage people to call then as well, because you should, but if they're struggling with paying their taxes, or if they're struggling with people using their food stamps, things like this, you should have them call us, and then we can advise them, and then we'll at least have a file open if we need to help appeal something or move forward. So I'm happy to answer any questions too. I don't really know if I spoke enough about how things have changed, but I think I did. So thank you very much.
Angela, thank you. It looks like there are a few questions that I think Regina will roll down through, but what's interesting listening to you, I'm a 23-year trooper, and I don't like going to court. It's nervous for me because you want to put on your A game. And imagine being a senior. We'll see how this plays out in the future, but I wonder if this Zoom type hearing will continue once we get back to pre-COVID experience. Is that something that you as an agency or we, I guess as a society, will accept? That if somebody is on the other end of that Zoom call, is that like being in the court? And I hope that is the truth, or that will alleviate some of that nervousness. But again, maybe that's something good that will come out of that. So thank you again for providing your view into to LSE. But Regina, do you want to roll through some of the questions that have popped up?
Yeah, sure thing. We had a question for Katie Conrad just a few minutes back, which is, do advocates find that Maine statutes regarding sexual assault have any gaps or fail to reflect sexual assault as experienced by elders, especially in facilities?
Yeah, I would attempt to answer that question. I appreciate it. So I actually hope that this is part of the conversation within the Elder Justice Coordinating Partnership, the work they're doing to create a roadmap in the next year for responding and preventing elder abuse. And I say that because I think there's going to be a policy priority area and look at those gaps. But when we did start conversation with the advocates around that sort of thing, there's two pieces of feedback I thought I'd pass along. One is something like restitution. So there is right now in policy that if someone passes away and they're owed restitution, it goes to their estate, but there's nothing saying that the person paying restitution doesn't also inherit the estate. And so the person who caused the harm could be inheriting the restitution money. So that's the gap. But I imagine there's more things like that just I can't think of right now, but that are going to be part of the conversation. And that was brought to us by community partners. And then the other thing is when it comes to institutions is I think about the amount of work it takes to partner with any institution. So when sexual violence happens inside an institution that has its own response process, and we need to figure out how to coordinate that alongside support services, potentially criminal justice, civil legal remedies, that it's complex. And I don't know a lot of advocates who have gone through that complex process of responding and supporting someone where something occurred within an institution, and we can sort of like navigate all those different paths and remedies, if that makes sense. So if anyone is interested in talking more about that particular partnership process and looking at institutional response in collaboration with community resources and potential criminal legal process, I'm super interested. But again, I think some of that is going to be coming up within this next year as a roadmap is being built. And I welcome, if anyone else has a way to answer that question as well, I welcome feedback.
Great. Thanks, Katie. And if I cut anyone off there too soon, just jump in. There's been a lot of great conversation in the chat, so I think a lot of people have probably been following it, but if you haven't been, please do check in there. Appreciating people really sort of sharing about their programming and how they're getting creative, and want to sort of recognize what Gia is sharing from Equality Maine and Sage Maine, this idea that they're creating a virtual Thanksgiving opportunity for older LGBTQ adults. I think that the holidays coming up are going to be a really difficult time for a lot of people across the lifespan, might I add, but particularly for older folks who are isolated. So that just seemed like a real sort of standout creative thing that I'm seeing in the chat. We've also had, we've had a couple more questions that were answered in the chat, whether Seniors Plus can help a person living with a family member that doesn't know how to reach out for resources and help for their person with dementia, and got an enthusiastic yes from Lori on that. Call them up. And then this is a question from me, but I put it in the chat like a good person. This question is for you, Angela. The BDN today had this big story about the backlog of criminal cases and then the impact that that's going to have for the time frame of resolving civil matters. How do you see that impacting older Mainers right now?
Yeah, so a couple things that might put your mind at ease. The protection orders, that there's a statutory requirement that those are heard within a certain period of time. Those will always be heard, and the judges will just have to make time for that, which is awful for them. I mean, I feel really bad for our judges. I think most of you know, or maybe you don't know, but our judges are very, very overworked here in Maine. I can say that for our litigation cases, like the cases that are filed right now, the pending cases in Superior Court, the ones where we're bringing full-on lawsuits, are being delayed and will be delayed, and it's coming into our mentality of for our clients, you know, they might not have 2 years to give to a lawsuit. So, you know, we're having that conversation. Can we push for settlement? You can actually ask the court to expedite things. They might not be willing to do that because, you know, before, historically they were, but they might just simply not be able to now. The Superior Court judges, and so the other thing is, so District Court and Superior Court, a little bit different. We might strategize and go to the Superior Court with something that we would have gone to the District Court, or vice versa. But certainly it's impacting our decision making and our clients, because recovery is always quickest if you can launch, either you launch a lawsuit and then they settle, which is great, or sometimes just intervening. But if you're going to play it out and it's going to go to trial, it's going to be longer. It's going to be much longer. And for me, I've actually had to ask for continuances in my case because my client's in a nursing home, and just doing everything, doing a mediation via Zoom, everything takes extra prep. And I just want to settle the case so bad, and so does he, but it's just, things are taking a long time. So I certainly think we don't have it as bad as the criminal folks, but we certainly are going to be feeling this for a while, and it's going to be affecting, I think, most the exploitation cases, because evictions and PFAs have requirements that they be heard at certain time frames. So those will always continue to be heard. But it's really the other types of cases that will be continued, or, you know, prolonged or set for a hearing in 5 years from now. Who knows?
Thanks, Angela. I also want to pull out here from the chat, you know, Lieutenant Hood had posed this question a while back. Is anyone here a part of a good morning or good night call program? curious if the length of those calls are similarly longer, like what Elise had mentioned. And Kimberly Snow has responded as a follow-up that the Muskie School has been trying to secure funding to research telephone reassurance programs and how they impact social isolation. And Kimberly would be very interested to hear from people who administer those programs, and puts an email here in the chat. So just wanting to call that out again for folks who might not have had their eyes on this chat the whole time, because that seems like an important place to perhaps be connecting for some of you. And I don't see any other questions that have come in or those sorts of pull out to share for the group pieces, unless folks want to add anything now. Oh, yes. And curious, and maybe you can put this in the chat. If you are a member of your local elder abuse task force, or if you are a member of your local triad, are those groups meeting? And if so, maybe just put that in the chat and where you're at. And if not, sort of curious about what the sort of challenges have been, or the, you know, that sort of decision making. We're all weighing so many things. Everything's a calculus these days. So if people have updates about those, we'd love to hear about that here in the chat as well. All right, Andrew Scoggin, Elder Abuse Task Force meeting virtually monthly, says Trinity.
Regina, could you cover that when we are done and this does move over to our website, will the chat be available for people to view as well after the fact?
Yeah, that's a great question. We can download the chat, and I don't remember if we talked explicitly about how we post the things, but we can certainly make that available for anyone who's wanting to see this afterwards. It's a great idea. Franklin Senior Resource Collective is meeting monthly virtually. Great. Greater Augusta area meeting monthly. So a lot of Zoom folks, and if there's anyone here who's interested in getting connected with one of those groups, reach out here, let folks know, hey, I'm in the Augusta area, I'd like to connect Angela or whatever, and get you connected with those. Yes, Somerset Senior Strong, which is similar to the Elder Abuse Task Force, is meeting monthly. The Kennebec County area is really actively looking to recruit folks to that group, says Angela, so has an email here. Great. Thanks, Trinity, for adding your email as well. I think, Pat, we might move towards our conclusion here as people put these last pieces in the chat.
All right, sounds great. So looking at, if you do have a printout, my good friend and co-chair for the Maine Council for Elder Abuse, Judy Shaw, was going to deliver the closing, but she happens to be in court. And as we heard, things are backed up, and when it does call, we go. So she is there doing her due diligence for certainly one of her clients. So I'll just deliver these closing comments. As I indicated before we started, there will be a survey that's going to be sent out. Those of you who have attended have seen these before, but it's really our way on the education and awareness group to determine the value of what we brought to you today. I don't know what it's going to look like in 6 months for our annual summit. I hope it's better, but we may be back here. So if there are ways that we can do better, please be candid with your feedback to us so we can really sit down and scrutinize that information. Our goal, again, is to bring you a product that after today that you can reach out either to an agency or to a person and say, I am having a challenge, or how did you do this? It's always been about networking for this smaller, more grassroots event through the council. And if we have met that goal and we're able to connect you with somebody, that's awesome. That's really what we set out to do back when we talked about this many months ago, knowing that COVID was going to be here to change the way we do business. really my sincere thank you to each of the panelists, and that's on behalf of the Maine Council for Elder Abuse, for stepping up and being one of the 10 to be on the hot seat. We duly truly appreciate your perspective, what it is that you and your agency deliver every day to members of this state that are in that niche in which we serve. That frontline work for all of you that are attending, whatever that might be, our thank you to you as well, because without all of us collectively, we know that safety net, it's going to have holes. But today, I've heard and know that, you know what, maybe there's another small layer below all of us that we weren't aware of. I think of what Joe's doing there. That was new for us, but that's pretty cool. And maybe that can be born in other parts of the state. So that's very encouraging. So survey that piece. I'll close by saying this. Take care of yourselves. We heard that from Dr. Shaw. And for my credit, I had that written down before he gave it from his expert view, but take care of yourselves, take care of your families, because if we're not 100%, we can't do the job that we all need to do. And the last thing I'll say, yes, it was great to see everyone, and we do work apart, but none of us are really truly alone with the relationships we have. So again, thank you. I appreciate your time. Be safe out there, and we'll see you soon.